And starting with news from the UK Prime Minister Boris Johnson has said that the country was in a race against time to roll out coronavirus vaccine as COVID-19 related deaths continue to rise and hospitals run out of oxygen. Johnson's advisors have warned that pandemic's worst weeks were imminent, and this as authorities have been struggling to contain the fast-spreading mutant COVID strain. Cases have been increasing in the UK despite strict restrictions. The COVID death toll has surpassed 81,000.
Very hard, I can tell you. We're trying to get this vaccine right. But it's a race against time, because we can all see the threat that our NHS faces, the pressure it's under, the demand in intensive care units, the pressure on ventilated beds, even the shortage of oxygen in some places.
And UK is stepping up its mass vaccination drive. The country aims to inoculate over 15 million people by mid-February. And the UK became the world's first country to approve vaccines developed by Oxford, AstraZeneca and Pfizer. It also approved the Moderna shot last week.
Personally, I think it was just really exciting, a great relief to feel that we now have some protection against this virus. You know, it's been quite worrying and you feel quite vulnerable, but it's just wonderful now. You sort of feel it's all beginning to move and the lights at the end of the tunnel.
Meanwhile, the country's lawmakers have been asked to wear masks inside the parliament as per the COVID rules.
Can I just say to members, wherever possible, please try and wear masks all the time, apart from obviously when we're speaking. So please bear that in mind.
And for more on this, we are being joined by our London Bureau Chief, Mandy Clark. Mandy, thank you so much for joining us. Now, the surge continues despite all the new measures and the mass vaccination program in place. How do you assess this?
This is really what the scientists have been warning about. There is that 2-week lag before those strict measures came in. And they have said it will always get worse before it gets better. But it is much, much worse than they could have predicted because of this mutant new variant. So they say has spread it far wider. And that's why the hospitals are experiencing more patients, more pressure than ever before, even from the first lockdown. This is the worst it's ever been. So really, we're not seeing the benefits of the lockdown yet. And also, people are not taking it as seriously. There is a level of lockdown fatigue. People want to get back to normal life. We see protests on the streets where people are protesting against more lockdown measures. So there is a level of uncompliance with the public. So those are two factors that are really putting added pressure on the NHS. Of course, we have the vaccine rollout. They say that 2.3 million people have been inoculated so far. They will get daily updates on how quickly they will be inoculating, but that is the way or the path they see out of this lockdown.
Yes, and now that you've mentioned that, UK is stepping up its mass vaccination drive and the country aims to inoculate over 15 million people by mid-February, and that's what we know as of now. What is the plan in place to reach this goal?
So they've created mass inoculation centers around the country. There was 7 open yesterday. They're planning to open more. These are areas where people can come in to get their vaccine. They have sent out letters for the people who are eligible. So they've leveled it in tiers. The people who are most vulnerable, they've gone to those care homes. But over 80-year-olds, they're asking people to come to these centers. But if you can't physically get there, they're coming to you. So they see these centers are really key to really speed up the inoculation process to hit that marker. Whether they achieve it or not is yet to be seen. But they're also claiming that every single adult in the UK should have been vaccinated by autumn. So they're really making this the main thrust because there's very little options. There's very little more they can lock down to really control.
All right, Mandy, thank you so much for joining us with all those details.